Hi everyone, today I'm going to talk about how you can have hypoglycemia without having diabetes. As you can see, hypoglycemia is a condition that occurs when the sugar levels in your blood are too low. Many people think of hypoglycemia as something that only occurs in people with diabetes. However, it can also occur in people who don't have diabetes. Well, hypoglycemia is different from hyperglycemia, which occurs when you have too much sugar in your bloodstream. Hypoglycemia can happen in people with diabetes if the body produces too much insulin. Insulin is a hormone that breaks down sugar so that you can use it for energy. You can also get hypoglycemia if you have diabetes and you take too much insulin. If you don't have diabetes, hypoglycemia can happen if your body can't stabilize your blood sugar levels. It can also happen after meals if your body produces too much insulin. Hypoglycemia in people who don't have diabetes is less common than hypoglycemia that occurs in people who have diabetes or related conditions. Everyone reacts differently to fluctuations in their blood glucose levels. Some symptoms of hypoglycemia may include dizziness, a feeling of extreme hunger, a headache, confusion, sweating, shaking, and personality changes. You may have hypoglycemia without having any symptoms. This is known as hypoglycemia unawareness. Hypoglycemia is either reactive or non-reactive. Each type has different causes. You see, reactive hypoglycemia occurs within a few hours after a meal. An overproduction of insulin causes reactive hypoglycemia. Having reactive hypoglycemia may mean that you're at risk for developing diabetes. And non-reactive hypoglycemia isn't necessarily related to meals and may be due to an underlying disease. Causes of non-reactive, or fasting. Although it's rare, a tumor of the pancreas can cause the body to make too much insulin or an insulin-like substance, resulting in hypoglycemia. Hormone deficiencies can also cause hypoglycemia because hormones control glucose levels. If you've had surgery on your stomach to alleviate the symptoms of gastroesophageal reflux disease, you may be at risk for a condition known as dumping syndrome. In late dumping syndrome, the body releases excess insulin in response to carbohydrate-rich meals. That can result in hypoglycemia and the related symptoms. Although having prediabetes increases your risk of diabetes, it doesn't mean you'll definitely develop type 2 diabetes. Diet and lifestyle changes can delay or prevent the progression from prediabetes to type 2 diabetes. If your doctor diagnoses you with prediabetes, they'll likely talk to you about lifestyle changes, such as following a healthy diet and managing your weight. Losing 7% of your body weight and exercising for 30 minutes per day, 5 days per week has been shown to reduce the risk of type 2 diabetes by 58%. In fact, hypoglycemia can occur in a fasting state, meaning you've gone for an extended period without eating. Your doctor may ask you to take a fasting test. This test can last as long as 72 hours. During the test, you'll have your blood drawn at different times to measure your blood glucose level. Another test is a mixed meal tolerance test. This test is for people experiencing hypoglycemia after eating. Both tests will involve a blood draw at your doctor's office. The results are usually available within a day or two. If your blood sugar level is lower than 50 to 70 milligrams per deciliter, you may have hypoglycemia. That number can vary from one person to another. Some people's bodies naturally have lower blood sugar levels. Your doctor will diagnose you based on your blood sugar levels. However, keep track of your symptoms and let your doctor know what symptoms you're experiencing. One way to do this is to keep a symptom diary. Your diary should include any symptoms you're experiencing, what you've eaten, and how long before or after a meal your symptoms occurred. This information will help your doctor make a diagnosis. That's the end of this video. Thanks for watching, and don't forget to click link in description below to discover more about the easy ways to lower your blood sugar and quickly reverse diabetes.